I'm Dr. Angela Mattis, consultant ophthalmologist at AB Vision Eye Care. Question for today is, Dr. Mattis, I'm 52 years old and I can't see well even with my glasses since I was diagnosed with macular degeneration. Can age-related macular degeneration be treated and cured, or will I permanently lose my vision? Now, to answer the question, we will talk about age-related macular degeneration, obviously, because this person at age 52 was diagnosed. Now, age-related macular degeneration, or you may see AMD or ARMD, is an eye disease that affects a specific part of the retina called the macula. Now, it is a leading cause of irreversible visual impairment worldwide, and it occurs in persons over the age of 50 years. Okay, what is the macula? The macula is the center of the retina. It is a specific part and it is the thinnest part of the retina. It has a high concentration of photoreceptor cells, and that is, we can consider the macula as the high definition part of the eye. In normal vision, light enters the eye and all the image is focused on the macula. So that is the most sensitive part. Now, in macular degeneration, the damage to the macula are of two forms. We have dry age-related macular degeneration and wet macular degeneration. Now, the dry form is quite common. As a matter of fact, over 80% of age-related macular degeneration is of the dry form. And this part of the macula gets deposits of protein called drusen. Now, drusen is seen in persons who get older in normal circumstances, but the type that causes vision impairment, if you will, are of a softer type. You get large clumps and concentrations of this soft type in the macular region. Now, wet AMD is less common and it is much more serious. In wet AMD, the blood vessels grow under the retina, right under the macula. Blood and fluid is leaked in the area. It causes scarring, and in this condition, you lose vision much more quickly. Now, what are the symptoms of macular degeneration? Now, persons with macular degeneration don't go completely blind. They can get severe visual impairment depending on the type. However, the peripheral vision tends to be less affected. So what we see with these patients, they may have no symptoms in the early stages. But as the disease progresses, the vision may get blurry. They may get dark spots in the center of their vision. They will have color vision abnormalities. And also, they may have inability to see in dim light. Specifically, the macula will be done. And so those photos that I showed you earlier will highlight some of the detailed changes that we see, and so we can diagnose it in that way. The AMSA grid is a specific test that helps you to see visual distortions. It is not specific for age-related macular degeneration. As I mentioned before, there are many macular diseases, and so the AMSA grid can be used to track severity or progression of the disease. And what happens is, when you use an AMSA grid, you cover one eye, you have good light, you will see distortions. There are certain horizontal and vertical lines, and you will see wavy lines, distortions, and you will see the lines in a particular quadrant. And that can help close in as to where you have the worst of the disease process. Now, what is the treatment? That's going to be on everybody's mind, because what our questioner wanted to know is, can it be treated, and more importantly, can it be cured? But if you remember in my introduction, I said it was irreversible. So therein lies part of your answer. We can treat macular degeneration, but it depends on the stage and it depends on the type of macular degeneration that you have. Now, there's no treatment for early age-related macular degeneration. What happens in this case is your eye specialist will probably just keep checking on you and checking on your eyes by having regular eye examination. Thank you for watching. See you next month for our next insightful session. Remember, if you have any questions, please remember to drop it in our comments section below. Have a nice day.